It seems extraordinary that there's nothing that the coronavirus doesn't touch.
All seen Black Lives Matter demonstrations.
Oppression is brought out.
So unfortunately, because I just feel like we're going down this road, we've been down this road before.
Like we've had Hello and welcome to Your Voice. I'm Tet Kofi. Health Secretary Matt Hancock said that a joint committee has recommended priority vaccination for frontline health and social care workers and, quote, those at increased risk of serious disease and death from coronavirus. He continues, as we learn more about the virus, we'll continue to take into account which groups may be particularly vulnerable, including, for example, those from ethnic minority backgrounds, so we can protect the most at risk first should a vaccine become available. Now, alarm has been caused by the release of figures indicating that the highest rates of COVID-19 infection per 100,000 of the UK population were in people of black ethnic groups, and that 90% of doctors who had died during the pandemic were from BME backgrounds. Many people of African and Caribbean origin have reacted to this with extreme concern, concluding that they would be among the first in line to receive any available vaccine. The cause of the huge disparity in the death rates between blacks and whites was investigated by Public Health England, but to date, the report is yet to be published. Government is reportedly concerned about public reaction following the nationwide demonstrations in support of Black Lives Matter, and the absence of an official explanation of the differences in death rates between black and white victims of COVID-19 has created the space for people to speculate. This has given rise to reawakened fears in the diasporan populations about vaccines, their impact on black lives, and the risks they run from having them. Tonight, we ask what black people in Britain feel about being among the first in line for the COVID vaccine. As always, your voice is welcome to add questions to put to our studio guests via the number shown on the screen below. Now, here in the studio to dissect this issue with me, first of all, our general practitioner, Dr. Charles Aseni, and medical doctor, Dr. Philip Idaiwo. A real pleasure to have you join us, gentlemen. Let's dive right in.
Thank you very much.
Thanks very much for having me.
Before this pandemic happened, would you have predicted that the morbidity rate for black people under COVID-19 would be as high as it is?
Absolutely not. If you look at it historically, we've had a flu pandemic. We've had the recent SARS-CoV-1 between 2003 to 2004. And during that period, the risk factors for dying did not include being of the BME community.
That's extraordinary. What do you say to that, Dr. Daiwo?
I think that it's a very complex issue to deal with. One, because when you talk about the issue of ethnicity and medicine, you are looking at diverse factors. One, you talk about genetics, the biology, there are differences, you know. And then number two, you look at the issues of socioeconomic, cultural, as well as behavioral patterns amongst the various ethnic groups, how we relate with one another.
Very good.
Yeah, but I think that at the heart of what we are witnessing is a composite of all these factors put together. I think that essentially there is a basic biological problem that is not being looked at.
I see. So we got downstream and upstream issues.
Absolutely.
But whatever the case, they were not predictable, as Dr. Charles Aseni has
Absolutely.
said. Now, earlier today, I spoke to GP and medical health educationist Dr. Robert Kahn, and this is what he had to say about the situation. Dr. Robert Kahn, thank you so much for taking the time to join us. I know you have such a busy schedule.
Thank you, Kofi.
Now, you're a GP within a partnership in Kent. You're also
That's right.
a medical health educationist.
and you
Yes.
are also the recent past president of the Ghana Dental and Medical Practitioners Association. So you meet a lot of our people and you know what they think.
Yes, that's right. Yeah.
Great. My first question to you is this. Of course, we're waiting for the PHE to release their report, but
Yeah.
why, in your opinion, have COVID deaths amongst BAME and specifically amongst the African population been so high?
Right, Kofi. Just to make it very brief, you know that since the pandemic started, when it started from China, and I just wanted to give you a brief, if you look at the number of people who died in China, those who died in Spain, those who died in Italy, those who have died in other countries where you don't have a BAME population, you would see certain risk factors are very common. Okay, this virus, let me say it is no respecter of persons. There have been so many reports, so many things said in the media that almost portrays us either as a reservoir for the virus or as more at risk than anyone else. Yes, in this country and pertaining to the UK in particular, or for example, in the US in particular, if you look at the hotspots where so many people have died, it is all about exposure. And then let's look at the BAME, that is the Blacks and minority ethnicity population as well. There are certain risk factors. The first factor would be occupation, for example. A great majority of our people, we live in the community, they do jobs that I call forward-facing roles. So for example, if you have 67% of the adult social workforce, okay, being from the BAME background in London alone, and these are people who work in care homes, who work as cleaners, for example, as bus drivers, as train drivers, in retail, in the hospitality sector. A great majority of these people are in contact with other human beings. So on a regular basis, they are talking to people. Now, the more you are in contact with infected people, the higher your risk.
So there isn't an issue actually relating to ethnicity as such. The issue is a question of the viral loads that our people are exposed to on account mostly of the jobs that they do. Is that the message I'm getting?
Exactly. That is what puts us at risk, because the report, the initial report that came out, let me quote something from the report. It said that social and economic inequalities, racism, discrimination, and stigma, different risks at work, and inequalities in the prevalence of conditions such as obesity, diabetes, hypertension, and asthma, which can increase the severity of COVID. So many of our people work in forward-facing roles, so they risk high exposure to the virus. If you add it to the fact that, unfortunately, in the majority of our people, we are also at risk of developing obesity, diabetes, hypertension, and asthma. Now, these conditions are not just limited to us alone, even though the risks are higher in our ethnicity. The more of these diseases you have, and you are exposed to the viral load on a regular basis, then you are more likely to die from it.
I'm afraid that we have to kind of move on with this now. Second question is that, do you believe that a vaccine is the solution to this problem with COVID? And in your observation, as you go through your medical educational work, what attitude do Africans have to this vaccine?
Your question is in two parts. A vaccine is not the ultimate solution, but a vaccine could be part of the solution. I think that within our community, the reason there's a lot of distrust is a lot of media information. You will remember, Kofi, that there were so many things people were saying about conspiracy theories in terms of what is behind this virus, in terms of an agenda to depopulate Africa and some of these BAME countries. Are you with me?
Yeah.
And then historically, you have racism, institutional racism, discrimination, stigma. Now, it paints a picture of distrust between our community and the powers that be. So if somebody then makes for example, if somebody makes a comment that, okay, this vaccine that is coming, let's make sure that ethnic minorities are not guinea pigs per se, that we should gear it towards ethnic minorities. I don't agree. Right. I believe that a vaccine can be a solution, but the vaccine must be given to anyone who is at the front line and who is at risk, whether they are black, yellow, green, or red.
That's excellent.
All right, then.
Dr. Khan, okay. Thank you so much for your time, and wishing
welcome.
You a great day over here.
Okay, now he had a lot to say, but Charles, if I may call you Charles.
Yes.
Can you tell me what struck you the most about his expo?
I think some of the things he mentioned, which is the risk factors for us getting it, which includes the kind of jobs we do.
Sure.
We are mostly in the front line.
Right.
And the other thing is the fact that a lot of black and ethnic minorities, we live in the inner cities. And it's not just that, it's not just what we do, and it's also our health-seeking behaviors. A lot of us do not immediately seek help, medical help, when we need it.
Right.
There's also the other fact of the fact that when you look at drivers, the bus drivers, mostly of ethnic minorities. So a lot of the things he says actually are right, in the sense that we are in the front line. We are at high risk of getting this viral load. We live in areas where we are more exposed to it in the inner cities. There's also the issue of trust and racism, discrimination.
Right.
So everything comes together to put us at a very high risk.
I see.
Yeah.
Okay. Well, you know, I'm going to go shortly to a break. We're going to take a short break now. But please join us again for part 2, where we'll be continuing the conversation. See you in a few moments. And don't forget to please send us your messages with questions about these issues. See you soon. And welcome back to Your Voice with me, Ted Kofi, and my guests, Dr. Charles Aseni and Dr. Philip Idaiwo. Now, Dr. Idaiwo, what was your main outtake from Dr. Khan's presentation at the top of the show?
I think I agree with all that he spoke about, but I think that one area that I would want to emphasize on top of all that he has said is also our behaviors, our cultural behaviors. You know, there are things that are peculiar to us. For instance, we are more touchy. We like to hug. We like to embrace. We like to congregate. You have families that live together, you know, in multiple members of the same family living together in some of the BMA communities.
Right.
All of these gives room for overcrowding and gives room for spread.
Right.
Now, if one person in such a household gets this disease, it does mean that in terms of transmission and the possibility of high viral load being delivered to others will be high because of the close nature of our communities.
Got it.
So I think it's very important that we look at that issue, because that is one way of helping our communities understand better how to take responsibility for our behaviors in order to take care of ourselves and also to take care of our...
Do you think, Dr. Aseni, whether the government's communications and messaging about these things has been sufficiently specific to take into account issues like what Dr. Idaiwo has just been talking about? Our cultural behaviours are different, and you won't change that in the space of 3 months. No. This is how people have been raised all their lives. They're touchy, they live in high occupancy homes, and so on and so forth. Do you think the government's messaging has been specific enough?
I don't think so. I think over time, the government has played a lot of lip service to the way they address problems within the BAMA community.
I see.
And you also, as we alluded to earlier, there's a lot of mistrust as to when the government is talking to us. What the government needs to be doing is to be engaging with local black groups, local BMA groups, where we know our people. We know their health-seeking behaviors. We know where to get them, how to reach them, what to say to them to get them to start to engage properly.
Right.
And this is what the government should be looking at.
Right.
A lot of the things that you hear in the media, there is just a natural mistrust of what is coming from the government. And you can understand that from years of how black people have been subjugated in this country.
I see.
And so whatever comes from the government is deemed, there's always a conspiracy theory about it.
Can I ask you, Dr. Idaiwo, how did people react to the response from the government that the reason they haven't launched the PHE report, which would have cast light on the real causes of the high morbidity rates amongst the black populations. The government said the reason it hasn't put out the report is that it was worried about the response to what was in the report on account of the Black Lives Matters demonstrations. Now, did that raise trust or did that decrease trust?
I would suggest that kind of a reaction from government would decrease trust. I think that we have to be bold enough to confront our demons, the problems that confront us, as a nation, as a people. And but what I mean by that is this: look.
Do you mean as a nation, the United Kingdom, or as a nation, black people within the United Kingdom?
As a nation, the United Kingdom.
Right.
All right. Firstly, we need to accept that generations of institutional racist behaviors have fractured the communities that should otherwise be together. We have to accept that is a reality. Whether here in the UK or in the US, where we have most of these issues, it is a fact. The second point is, if there is an issue of health, as we are talking about, that impacts one specific community, I think that we should be bold enough as well to relay that information and deliver it. The point of trying to sex up or play politics with health is something that I'm very uncomfortable with.
But are there groups and organizations that the government can work with and liaise with to make sure that their message is fine-tuned or properly delivered, or kind of bridges are built with these communities, Dr. Seni?
I mean, that's an interesting question to ask. For example, I'm the chairperson of a group, of a GP group in Hertfordshire and Bedfordshire. So it's called Afro GP Hearts, and we've got a collective of about 80 general practitioners working across both counties.
And are you saying that these are all black GPs?
They are all black GPs of African descent working in these areas. And this is a group that can easily, and the group have been working in the community, helping the community, apart from being in the front line, have also been doing charity work. So they know where to go, they know how to reach these people, they know how to get across to them. And these are the kind of groups. And it's not just the only group. There is MANSAG, which is the Medical Association of Nigerian Doctors. There's BEAPIO. So there are a lot of ethnic minority groups, medical professional groups that the government can actually
tap into
and get them to educate, send these messages out to their community.
So, Dr. Adaiwo, whose fault is this? You're medical practitioners, both of you, you're scientists. You know the facts of what's going on with COVID. Whose responsibility is it? Is it for you to speak up, or is it for the government to reach out?
I think it's for the government to reach out, because regardless of how much as community groups you attempt to reach out or to speak out, there's one or two things that could possibly happen. Okay, your community group decides to speak up and you inflame tensions because of the messaging and because you are speaking out and the government is not engaging. And therefore you may end up causing more problems. Whereas if government speaks out, government engages, reaches out to these small community groups across the country, it will be a synergy of government and the people working together to solve problems, and indeed may probably be cheaper to deal with problems at that level. So I think that the government needs to take the initiative. Okay, the ball is in the court of government to make the move and reach out to community groups, work with community groups and community leaders to ensure that the right messaging is released and how best to release it.
I see. Now, I have to ask a question now. Is a vaccine the best solution to this pandemic, first? And secondly, do you think that black people in the United Kingdom are happy to be amongst the first in line to receive this vaccine? Charles Seni.
Just like Dr. Roberts said earlier on, I think the vaccine is part of the solution. The main thing is we continue with what we're doing now, which is washing our hands, social distancing, trying to keep the virus itself at bay. But after that, of course, definitely there needs to be a vaccine to protect people. But in terms of who goes first, there is a shielding list of people who've been told by the government to stay at home. And they've been staying at home since April. And that list they were supposed to end at the end of June, and that's been sent till the end of July.
It's been extended.
Yes. So those people should be in the first line. These are the people who are most likely to succumb to the disease. So those people, irrespective of their color, should be the first in line to get the virus, to get the vaccine. And then after that, then you start to look at the other people who normally will get the flu vaccine at the end of the year, people who've got diabetes, who've got hypertension, people who are
older,
above the age of 65. I think when Matt Hancock spoke, he talked about people above the age of 50.
Yes.
But there are also people above the age of 65 who have all these other conditions, who at the end of each year will get a flu vaccine.
Right.
Those people should be first to go, irrespective of their race.
Now, within the rate of prioritization, as Charles has just mentioned, would you expect people of Afro-Caribbean background, based on the mortality rates that we are seeing here, would you expect them to be first in line amongst the priority communities?
Let me answer this question. You know, I did a small survey recently, you know, why this vaccine issue has been there because of the conspiracy theories. And it's mostly amongst the respondents who are mostly Africans or black people.
Right.
And the majority of respondents there, over 65%, didn't think that vaccine would be the solution. They didn't think.
What reason was given in your survey?
I didn't ask that question. I wanted to find out from them, do they think that vaccine will be the solution? The other question was, if and when vaccine becomes available, will you encourage anyone to have the vaccine?
Right.
Okay, and the response I got, about 34% said yes, about 37% says no, about 25% says undecided. So it's a very close call. Now, I gave the results of this survey to underscore the fact that it is one thing for the vaccine to be available. It's another thing to have uptake in the community.
Right.
Which is the question you are driving at. Now, we are still a long way from having a vaccine in the first instance. Okay. We are still quite a long way,
right,
from having a vaccine.
Right.
The leader in the team at this point in time is the Oxford University group.
Correct. Yeah.
And they are just, I think, in the first phase of clinical trial.
Into phase two. Phase two.
So it's still a long way away.
Okay.
So that is the first thing. So I totally agree with Charles.
Okay.
That vaccine, at this point in time, is just one of the solutions. The other solutions we have to be looking at, aside from all the social demographic factors that we've talked about, is a drug. Is there a drug that can be used to kind of blunt
the impact of infection?
Absolutely.
Charles, can I say very quickly now, we have only a few minutes left. Do you think that the battle of hearts, which is required to build trust between the black populations and the government, can be won? If so, how? Very quickly.
I think it still goes down to the same thing. And if you don't mind, I'm going to go down history. Slavery was abolished in this country in 1833. Between then and now, only probably about 2-3 black people have been considered good enough to serve in a British cabinet. Now, over years, a lot of black people have been subjugated, institutional racism, glass ceiling. There is a lot of mistrust. So there's nothing coming from the government that the black people will take. It's going to take a long time. So whatever the government says, there will always be a conspiracy theory. Even if they come out, no matter how forthright, there will always be a conspiracy theory. The government needs to work very, very hard with local black groups. Be true to what they say. Stop paying lip service. Be true to what they say. Say what you mean what you say, act. Not the occasional dotting of black people in respective places, but making sure that it's a polka dot. You have so many black people in governmental positions, in schools, racism starts to go away.
To bridge the gap.
To bridge the gap.
Thank you very much. Well, that's the end of part 2. Join us after the break when I'll be joined by Winifred Ohinikesi and Stephen Sisali. And it's been an absolute pleasure. Thank you for your insights. and your words of wisdom on this subject.
Thank you very much.
Thanks.
And welcome back. You're watching Your Voice with me, Ted Kofi, and my guests for this half are registered nurse Mrs. Winifred Ohinekisi and nutritionist Stephen Sisali. Now, lady and gentlemen, we have taken some vox pops with people and we asked them their view about vaccines and vaccine trials across Africa to gauge a sense of their trust and belief in the system. What do you think their reaction is going to be?
Well, to prepare for this show, Ted, I've been talking to a number of people from Black, Asian, minority backgrounds, and the feedback I'm getting is rather grim in the sense that they do not have much confidence at this stage based on previous experiences with vaccines.
It's just a quick comment. What do you feel in your interaction with people in the community about their trust in vaccines and the medical establishment?
I think one of the things we have to look into is the history and also why this is being brought in at this particular time. Okay. One of the things people are mostly concerned about is the fact that there is no information being provided on nutritional care and also preventative methods.
Fantastic. Now, we have the opinions of some of our younger viewers. This is my voice from Charlene, Tomiwa, and Gabriel. Take a look.
So, should the potential coronavirus vaccine be tested on trials in Africa? My short answer is no. I mean, why? I haven't seen any evidence, I haven't seen any information to evidence why it should be. If we look at the stats, the information that's available to us, we see that the majority, if not all of the countries in Africa have actually managed to maintain quite low infection rates and deaths. That's in comparison to the majority of Western countries. So, and if we're looking at, I guess, the narrative that we have in the UK, that Black people are more likely to catch coronavirus, and then we compare that to what we see in Africa and the Caribbean, where there are more Black people, then surely that's more a social or economic reason as to why the rate of infection for Black people is higher in the UK, not an indication that it's higher and Black people are somehow more at risk than the rest of the population. I think it's no.
Whether or not people in Africa should be given first priority to vaccines from COVID-19, I think there's a lot of factors that you have to kind of consider when you answer that question. One of the main ones being that, is it actually going to be first priority, or is it going to be that the vaccine is being tested on people in Africa? Because European countries, Western countries have a long history of exploiting Africa and using Africa as guinea pigs and test runs for their experimental, whatever you might want to call it. So from that perspective, I don't necessarily know if it would be the best idea for everyone to be for anyone to be clamoring for Africa to be first in line for the vaccines, especially when you consider that with the numbers that were coming out of most of the African countries at the beginning of the pandemic, of the global pandemic, that it really seemed to be a situation where there were very few cases, and a lot of the cases in the initial stages were being brought about by European travelers coming to African countries. So in that situation, there's probably to some extent a lesser demand per capita than there might have been as compared to some of the countries where the numbers were really quite staggering.
Anyone that's read the book by Harriet Washington called Medical Apartheid will understand the complexities involved with between Africa and vaccines. For years, pharmaceutical companies have been using Africa for clinical trials. So when you ask the question, should Africa be given a priority for COVID-19 vaccines? The automatic answer is no for me. I believe the country with the highest death rate as a result of COVID-19 should actually be prioritized. Then maybe Africa, because that way you can set the ethical boundaries, you can make sure that everything is done by the book. Because when these companies and pharmaceutical companies go to Africa, it's a completely different ball game, and some of the experiments and some of the vaccinations can be deemed unethical when it gets to Africa. But if they do it starting from the highest country with the death rate as a result of COVID-19, I think you set the ethical boundaries and things are properly done that way.
Very interesting, isn't it? Winifred, what's your outtake? Of course, they were talking about the vaccine being used in Africa, but how does those attitudes chime with the attitudes that you found talking to the people that you work with?
I think this seems to be a very true reflection of what most Africans are thinking out there. At the start of the pandemic, I mean, when you were on shift, obviously I am talking as a nurse, there was the likelihood of having all ethnic minority people
on a
shift, you know, and by that sometimes I even relate and try to make it like exciting by saying it's like we are in the United Nations here. By that I meant you have Filipinos, Africans, many more Africans, and all on just one shift, and probably doctors who are Indians and more nurses who are Indians as well. So it's hardly surprising that it affected the black ethnic minority groups so much.
Can I ask you, doesn't it surprise you that if there are so many of them, minority ethnics, particularly black staff, at the nursing level, at the medical practitioner level, we've been told that 90% of the medical staff who died, of the doctors who died, were from BAME backgrounds. Why couldn't they speak up to deal with this situation?
I think they were in a state where they were following what they call their duty role of what they came to serve in that role that they came in. But what we also got to look at as well is that it's not even why they couldn't actually respond, it's the fact that whenever you are given a schedule, your outlook is to respond to that schedule according to how it's been set.
Without question.
Without question. Now, the key question is here, are vaccines really safe and effective? We have to look at the history of vaccines. Where do they come from, and how is it that today in the world that we're living in, we have got literally in the US, there's a vaccine compensation program that has given over 150 billion in terms of compensation to children who've suffered from MMR injury. So if we are in a state also if you look at cases in Africa, where there's also a case in Kenya, where the Catholics in Kenya, the Catholic priests found that Kenyan women were becoming sterilized through the vaccination program. So this is also lends us to a situation where people are now feeling there's a sense of uneasiness about a vaccine, which is what we're seeing today. People are wanting to actually ask questions. What is in the vaccine? And today we're seeing that formaldehyde, aluminium, mercury.
Mercury?
Yes, in the
vaccine. That's a highly toxic substance.
Highly toxic substance. And at the same time, you've got things like phenol, again, an alcohol, very toxic to the body. So when we put all these straight into the system, actually it becomes very toxic to our bodies, and the body's immune system becomes disrupted and cannot respond to the environment. Today what we're seeing is that a lot of children receive up to 52 shots in 1 year. And a lot of these children suffer from sudden infant death syndrome, and some of them actually go through what they call challenges in terms of autism and eczema as they grow up because of the vaccine-related challenges.
This is what the National Health Service, our National Health Service, which my taxes, your taxes, and your taxes, pay to look after us. Sometimes vaccines cause mild side effects that will not last long. Some children may feel a bit unwell and have a sore arm for 2 or 3 days. They reduce or even get rid of some diseases if enough people are vaccinated. They do not cause allergies or any other conditions all the current evidence tells us that vaccinating is safer than not vaccinating. They do not contain mercury, thiomersal, and they do not contain any ingredients that cause harm in such small amounts. But speak to your doctor if you have any known allergies, such as eggs or gelatine. Now, this is what the official voice of the NHS is. My question to you, Winifred, is, do people believe it?
I don't think people believe in this. People do react a lot to vaccines, and I can only cite, for instance, the flu vaccine that we have every year as an example. Not many people react to it generally, but then a lot of people do as well, and they do have like flu-like symptoms initially, which tends to last just for a number of days, a couple of days, and then it passes. So it is very difficult to convince people that vaccines hardly have any side effects as such. I mean, a lot of people are rather concerned because generally vaccines take a number of months, 1.5 years, 18 months, 2 years to develop.
Right.
And this is rather come on very quickly because the pandemic started somewhere towards the end of the year. So it's taken about 6 months. So people are worried that how come it's been developed to this stage, to the extent of it being trialed, and why
so quickly, you're saying.
Quickly,
right.
you know, and that is a concern. And especially because the black ethnic minorities are being considered as to be, you know, tested with this vaccine. Bear in mind, a lot of them don't even know whether they have underlying conditions or not. And I say this practically. People don't even know whether they are allergic to antibiotics or not, let alone know whether they are allergic to any vaccine.
Fantastic. You know? We're going to come back to this, and we're going to come back to your regime of maintaining the basic immune system. That's the end of part 3. Join us after the break, when we'll be coming to a conclusion on our conversation today on whether people of African origin are happy to be first in line for the vaccine, right here on Your Voice. And keep your comments coming. Welcome back. You're watching Your Voice with me, Tet Kofi, and my guests, Winifred Ohinikesi and Stephen Sisali. Now, we've come to the nub of the whole issue as to how to manage this pandemic. Secretary of State Matt Hancock has suggested that because the morbidity rates, where black men are twice as likely as white men to die of COVID, and black women are 1.4 times as likely to die as white women, that we are a seriously at-risk group. Can I ask you this? Before the pandemic struck, based on your health as a nutritionist and so on, would you have predicted that so many black people would die from COVID?
I think that is a very good question, because basically what it means that we were unprepared and it was unpredictable and we were caught unaware. We've got to remember that black people in the UK here are also in a situation where they because of melanin, they actually need a large amount of sunshine, which they're having not enough intense sunshine for 4 months of the year. So this predisposes them to lower levels of vitamin D, which can also create what they call predisposition to getting into a situation where they have actually made more predisposed to something.
How
like
many
COVID-19.
minutes, for example, of sunshine does a white person require as opposed to a black person require to produce the vitamin D which is required to support their immune system? Do we know this?
Okay, basically what we would need is strong, intense sunshine, but so long as you can spend up to 2 hours at least exposure, or even longer, that would actually produce vitamin D under your skin. But at the same time, it will also, because they're showing there's a now indication between levels of vitamin D and prostate cancer and many other cancers that are hormone-related cancers that actually appear more in people of African origin.
I see.
So what we've got to remember as well is also the fact that our nutritional care has also dropped. The food that our ancestors ate is not what we're eating today. So we are now more predisposed to illnesses, being in a different climate, but also not underlying that the very fabric of the climate is also predisposing us to the fact that a lot of us are going into what they call an area where refined foods, processed foods, and all kinds of foods are becoming the mainstay. Now we also got to go back to what was done before vaccination. People had good sanitation, they had good nutrition, and they also used herbs, vitamins, minerals, nutrition to help strengthen the immune system. But what we're seeing right now is a total reliance on vaccination. And what we are now opening ourselves to is an unknown Pandora's box of unknown conditions that could result from the vaccination
and
campaign.
Consequences.
That's right.
Winnie, let me come to you here. I mean, you're a practitioner. Have you people in the health business dropped the ball? For example, why don't I know that I need 3 or 4 times the amount of sunlight to produce the vitamin D my body needs just because of the melanin in my skin? Why doesn't every black person in Britain know this? Why isn't there the messaging to publicly educate people about these things? Can you explain?
Oh, I think public education has always happened, but it's whether people are even interested in listening to it or not. Because I'm sure there is a lot of information around, but it's just the sources, and there is so much other deviations on the way as well. People are not so much interested in health programs as such. And I'm saying this from a practical point of view, because obviously, you know, I'm involved in a health show. And then when you just even compare the kind of viewings you will be getting for health shows as against, say, entertainment, you can tell straight away that people are not just listening. There is a lot of information out there on our phones, on NHS websites. There are lots of programs in health that are going on, but just compare the views and you know the people are just getting on with other stuff which are distracting rather than focusing on their health.
But is it right for us to blame the consumer? Isn't it surely the person who is supposed to be crafting a message, encoding the message, and delivering the message? I mean, your health program is absolutely wonderful. It comes across with an extraordinarily positive tone of voice, and it's very listenable. But to be honest with you, when we look at the communications of what's coming from the government on the pandemic, I'm not sure it's particularly appealing. And let me ask you specifically this question. Do you think it was a good idea for the health secretary to let slip in that briefing that black people would be prioritized or might be prioritized for the vaccine, given the history of events that has existed?
I think what we're looking at here as well is that when you actually have a single group singled out as the first line, when something is considered a pandemic, it's affecting everybody. Why would you want to take a single group out and say they're the first line of what they call defense to be allocated the vaccine?
Because
it creates questions in their mind automatically.
His rationale is that, you know, me and you, we are twice as likely to die from COVID as our Caucasian friends.
Ted, look at what happened in Africa. Okay, the WHO vaccinated using polio vaccine. In the 60s and 70s, they vaccinated over 80% of sub-Saharan Africa. And that was reported in the London Times. That led to the explosion of HIV/AIDS. And this, up to now, 80% of the world's cases of HIV are actually currently in Africa. So when you talk about really vaccines and the relationship within the African continent, we are also seeing that there's a lot of history of the fact that people have mistrust of vaccines. So we have to now look at things. How can we actually look at boosting the immune system? How can we look at strengthening the immune system? Because there are thousands and billions of viruses all around us all the time. COVID-19 is something new on the scene, but at the same time, we've had Ebola, we've had Zika, we've had chikungunya, we've had SARS, we've had H1N1, we've had West Nile virus, we've had all these viruses, yet our systems literally have not been looked at in terms of the fact that the Creator has blessed you with an immune system. What you need to do is strengthen that immune system. The body has got an inbuilt repair and regenerative capacity, but we never look at that. We always look at introducing diseases from outside so that the body can make antibodies, which is what the vaccine proposes. So they'll give you a bit of the COVID-19 virus, and then you'll make your own antibodies inside. But what happens when you actually strengthen the immune system and you strengthen your internal defenses? Now today there's so many herbs like thyme. Thyme is now something you can find in supermarkets. Just by boiling thyme tea, you can prevent yourself from viruses and impacting your system in a strong way. Reishi mushroom and many other things that are nutritionally benefit, like zinc is very good for the immune system. Magnesium, copper is very important for absorption of iron. There are so many nutrients that are really very good at optimizing the immune function. Echinacea, astragalus, but we never look at that. We always focus on the chemicals that cause more damage, that create more problems, that eventually lead to more side effects.
What is the name of your branch of nutrition?
I look at holistic nutrition. Why? Because the whole body is about mind, body, spirit. In a world where the whole world is moving towards natural health, the whole world is moving towards holistic health, the whole world is moving towards looking for natural solutions. What we have is a system that does not want to look at anything of that nature. And we have to look at how we can begin to manage when somebody says everybody's going to be vaccinated, and in order to, if you don't get vaccinated, they'll say, Ted, you're putting other people at risk. If you don't get vaccinated, they said, she's putting other people at risk. Yet at the same time, we are now facing a specter of something that has never been tested for safety.
I see.
Tatum, can I just
Please,
say
go ahead.
this?
Go ahead.
Because through interaction, it came across that if people, the blacks are being exposed to it, people have been put off work for about 3 months, 4 months, 6 months. Why couldn't they put them off work as well? Because the NHS,
who off work?
The black ethnic minorities who were at the front line.
Right.
Because they still kept working.
Well, they were considered essential.
They were essential. They were essential, but they were dying as well because they were exposed.
And what's your solution to that issue?
Well, I mean, at the moment, it's getting better. So it's a little bit too late now, even though it's an ongoing issue. The numbers are really coming down. So now the priorities will change, and probably your suggestion of boosting our immune system
may come more to the front.
Yeah.
We have a listener, a viewer from London. Her name is Fola. She says, how have the number of undocumented people been noted in the figures on COVID? Do you have any idea about that?
How have the
number of undocumented people been noted in the figures? Meaning that if somebody is here not without the right immigration papers, how are they still counted into the figures of morbidity and infection and so on and so forth?
No, I don't have any idea of.
I think it's about at the moment they're saying 12,500 people have passed since February in terms of African black BME statistics show that.
Right.
So what we've got to remember as well is that a lot of people will not be tested fully because the testing mechanisms are not being rolled out across the country to thoroughly investigate who is exposed and who isn't exposed, and also how do we actually clarify that.
Very quickly now, we really must come to the end, unfortunately. Do you think black people are happy to be prioritized for the vaccine, based on what you know of them?
I don't think they have enough information to believe in the systems in place at the moment.
And you, David?
Stephen.
Stephen.
Our voices need to be heard, because at the moment, nobody is actually holding a panel discussion to really bring this to the forefront and engage the African community and find out what are their thoughts. How can they contribute to their own safety in terms of health?
Thank you very much indeed.
Thank you.
Well, that's all we have time for on this edition of Your Voice. We did have a panel discussion about what African people think about, particularly on this subject. Thank you to my guests in this part, Winifred Ohinikesi and Stephen Sisali. And of course, to my earlier guests, Dr. Charles Aseni and Dr. Philip Idaiwo. And thank you for watching. I'm Ted Kofi. Please join us again next time here on Your Voice. It seems extraordinary that there's nothing that the coronavirus doesn't touch. All seen Black Lives Matter demonstrations.
oppression is brought out.
It's unfortunate because I just feel like we're going down this road. We've been down this road before.
We've had